Hi, this is Pooja with Mom to Mom OB, where real women get answers from real doctors about the issues concerning them. So today we're going to talk about complications that occur after delivery, and this is part of our childbirth series. So we talked about labor being broken up into a first, second, and third stage. So the first stage is dilation, going from 0 to 10 centimeters dilated for the cervix. The second stage is the pushing, where the baby is making its journey through the birth canal. The third stage of labor is after delivery, where the placenta is delivered, and you can have issues with retained placenta or hemorrhage during that time, and we'll talk about each of those. And then following delivery of the placenta, there's a period of time which is sometimes referred to as the fourth stage of labor, but this after delivery period of time can have its own issues that can arise. And so we'll go through each of those as well. So in the third stage of labor, this is after baby's delivered, where everybody is sort of coming down off of this emotional high from the delivery. And sometimes, everyone sort of thinks that the birth is over, and, there's still the ugly twin, sometimes is how it's referred to, or the placenta that needs to be delivered. And the placenta is the organ that basically is the interface between mom and baby. It's its own organ. It has its own, blood supply that basically extracts oxygen from mom, and then through the organ delivers that oxygen to the baby. And so most of the blood in the placenta is actually fetal blood, and maternal blood and fetal blood never mix. So it's basically the interface allowing for oxygen exchange, but no actual blood mixing occurs. So that organ is adherent to the maternal uterus, the inner lining of the uterus, and so it needs to detach and be delivered as well. And so because it's this interface, it's sort of this fixed disc. It kind of looks like liver. When it's delivered, it actually delivers inside out, and so you see the outside membranes, and it kind of looks like a jellyfish. But as the uterus contracts down after the baby's delivered, the uterus becomes very small relative to the large gravid state it was in before baby was delivered. And when the uterus becomes very small, this disc-like organ shears away from the side of the uterus. And so you'll see your OBGYN or your midwife rubbing your abdomen. Sometimes there's a internal hand in the vagina rubbing the posterior aspect of the uterus to try and get it to contract down and shrink down so that it causes that placenta to release. And so as the placenta releases, there will be certain indicators. There'll be blood there's a gush that occurs. The cord will start to lengthen, and the uterus will feel very globular and hard. And so as you deliver the placenta, as your OBGYN delivers the placenta, you may be asked to push, or you might not. Again, it's a relatively passive process that's stimulated by those contractions of the uterus. And during that time, a bolus of Pitocin is usually given because that can reduce the amount of blood loss that occurs following the delivery of the placenta. So maternal hemorrhage is the most common complication that happens during this third stage of labor. And maternal hemorrhage, is basically the uterine side of where that placenta was removed from that bleeds because of that sort of scab that's been picked off. These exposed blood vessels, if the uterus doesn't contract down right away, will bleed. So ways to address or prevent postpartum hemorrhage is to give medications called uterotonics. So Pitocin being the most common one, as I said, oftentimes is bolus as part of the hospital protocol. But then there are other medications. There's a rectal medication called misoprostol that can be given that does the same thing, causes the uterus to contract down. And when it contracts down, it kind of provides the muscles of the uterus, those muscle fibers act as like a tourniquet to those exposed vessels and make them become hemostatic and not bleed as much. There is a shot that can be given called methergin, and that shot does the same thing. There's also a medication called hemabate that does the same thing. It's a shot, again, that causes the uterus to contract. If those remedies don't do the trick and you continue to lose a lot of blood in this period of time, other interventions include TXA, or a medication that promotes blood clotting and hemostasis, and that is another IV infusion. Or there are actual mechanical balloons and compression that provide compression to the inside of the uterus, and that compression against those arteries will, again, kind of act as a tourniquet to get them to bleed less. So those are some of the interventions that we have that can be offered on labor and delivery. Now, if those don't work, then the other options are actually offered in the operating room and are surgical interventions that can address the uterus directly by making a incision on the abdomen and then addressing the uterus either by suturing or in the worst case scenario, removing the uterus to address sort of life's life-threatening bleeding. That happens very rarely, but is sort of the last resort if we can't get control of the bleeding. Those are some of the major issues that occur following delivery. Some less serious complications, but still problematic, are lacerations. So vaginal lacerations was the other issue I wanted to talk about during this video, particularly because it's a topic that I think a lot of women have a lot of fear around. Hopefully I can help dispel some of that fear. So the vagina is made of a really amazing tissue that's not found anywhere else in the body, and it's this very elastic, almost skin-like tissue that's both thin and strong at the same time. And so when lacerations occur during childbirth, naturally with the delivery of the head, first-time moms will have a small laceration that goes through the vaginal tissue and often into some of the muscles that support the pelvic floor. Those can be repaired on labor and delivery in your labor and delivery room, and the vast majority heal well and do not have issues moving forward. If you develop wound breakdown from that incision, or if you have issues down the road with incontinence, these are not normal and should be brought up to your OBGYN so that the appropriate interventions can take place, the appropriate revision of that surgical repair, as well as the appropriate physical therapy so that you can regain that muscle support. So those are some of the scarier potential issues that can occur following the birth, and hopefully the information will help assuage some of the anxiety around those issues. And I welcome all of your questions and comments below, and I'll make sure to answer those as soon as I can. So thank you so much for joining us, and we look forward to talking to you next time on Mom to Mom OB.